People use what works, and since proteolytic enzymes have been in the top 5 of all the supplements from Biotics research for over 20 years, I thought we should talk about them. Medical studies have shown dramatic reduction in healing time with proteolytic enzymes. One author, after reviewing 14 different studies using over 1,500 subjects, said the length of recovery time was cut in half by using proteolytic enzymes. Proteolytic enzymes are indicated for edema, swelling, and acute injury. They've been used as digestive aids for low back pain, disc herniation, reduction of food allergy symptoms, acute and chronic sinusitis, increasing the effectiveness of antibiotics, post-surgical trauma and recovery, and as a natural vermifuge. Below you can access an educational piece that shares the highlights of 17 studies, but here is one that really says it all in terms of reducing healing time. This study comes from Enzymes and Enzyme Therapy, a book by Dr. Anthony Shikoki. He cites an aggressive sport, karate, and although he doesn't mention dosages, this study represents what I've seen with myself and my patients over the last 20 years. 10 karate fighters of both sexes were given enzymes before an event. The second group of 10 was given a placebo. All 20 athletes had comparable injuries. Here are the impressive results. Hematomas disappeared in the treated athletes in 6.62 days, whereas placebo athletes took 15.59 days to heal. The swelling in the enzyme group disappeared in 4.25 days versus 9.82 days in the control group. Restrictions in movement as a result of pain and injury disappeared in 5.04 days versus 12.62 days for the placebo group. When the injury suffered in the karate competition became inflamed, it took 3.63 days to subside versus 10.56 for the control group. For the people who were injured and were unfit for work, the enzyme group was able to return to work in 2 days, whereas the placebo group was unable to return to work for 5.29 days. Although this is a small study, it's consistent with other studies which show injuries heal faster, recovery time being reduced to 50% in many cases. I've talked to clinicians over the years who haven't shared my enthusiasm until they learned how to use them correctly. So before you try them, let's address a few issues. The first thing we should be aware of is all enzymes are not alike. Sometimes the life or activity of the enzymes has expired before they were ingested. I've purchased and then tested some products that didn't have any detectable enzyme upon assay. Contrast that to one of Biotics' flagship products, Enzyme Forte, which met label claims 8 years after the expiration date. Enzyme Forte by Biotics Research is a broad-spectrum proteolytic enzyme formulation containing pancreatin, bromelain, papain, lipase, amylase, trypsin, and alpha-chymotrypsin. You see, enzymes are a whole field unto themselves, and certain precautions must be taken to make sure that they're active when the patient takes them. That's one of the wonderful things about working with Biotics Research. Their enzymes meet or exceed label claim every time. So one reason people might not feel or might not get results with other enzymes is poor manufacturing. Another reason is that enzymes should not be taken with food. Enzymes are catalysts, and they can have major effects on natural healing, but if you take them with food, they will act as digestive enzymes. Another positive side effect of proteolytic enzymes is that they'll lessen the effects of food allergy symptoms. Knowing this, for best results to reduce inflammation and to maximize their systemic benefits, take Enzyme Forte 30 minutes before a meal or 2 hours after eating. The third reason is that people don't take enough. Always start with a loading dose of 10 tablets. Increase the loading dose if your patient is large or once you have experience with the product. Then recommend 5 to 7 tablets 3 or 4 times per day between meals. I've had several basketball ankle injuries back in high school. You know the kind where you twist an ankle after coming down with a rebound? So I know how painful a twisted ankle can be. Several years ago, I was excited and ran down the stairs only to miss one of the middle steps. I fell about 6 feet and landed on my ankle and twisted it just like I had done in high school. I saw stars. After writhing in pain for about 10 minutes, I crawled on my hands and knees to a chair and promptly took 15 Enzyme Forte from Biotics Research and asked my wife to find some ice. I proceeded to take 5 tablets every 3 hours that I was awake, away from food. The next day, I was not only walking, I was totally pain-free. It was amazing. Enzyme Forte can be used for any type of injury or accident, from running, gardening, skiing, and any type of weekend warrior experience that leaves muscles tender. Enzyme Forte is also safe for children when they experience any type of injury. So if you haven't used proteolytic enzymes for yourself or your patients, give Enzyme Forte a try. You'll be pleasantly surprised. Thanks for watching. I look forward to being with you again next Tuesday.